The Royal Society for Public Health.
The Royal Society of Public Health.
The Royal Society of Public Health.
The Royal Society of Public Health.
The Royal Society for Public Health.
Two-thirds of people supported the idea of labelling calories in alcoholic drinks.
In real life, most of us are used to seeing calories on things now because we have calorific labelling on our food.
We're not losing the harm message, we're just packaging it slightly differently so that people can have a positive message about how much they eat and drink, both from the point of view of their weight and their alcohol consumption.
What we found from our research is that the public simply don't know. They either, about 4/5 either don't know or underestimate how many calories are in your typical glass of wine, champagne or pint of lager.
But we still have to recognise that there is something like 7 million people who still smoke, and anything that we can do to help them to quit is going to be a good thing.
If you realise that smoking kills 100,000 people every year and it costs the economy £13 billion.
Nicotine is addictive, and if you're trying to give up smoking, then taking on another nicotine substance, so a lozenge, a patch, an e-cigarette is much more beneficial if you're trying to quit smoking. And we think by an exclusion zone we will really help people to move on to e-cigarettes and denormalise that smoking.
One in 3 children are overweight or obese. 1 in 5 children leaving primary school are obese. So that's a large proportion, a significant proportion.
Fast food takeaways were cited by the young people as being probably the most significant contributor towards obesity. And actually, the delivery of fast food takeaways from phone apps is quite concerning because schools have done a lot to drive up school food standards. And actually local authorities have done a lot to clamp down on fast food takeaways near to school. So this is a really concerning development.
It's time to eliminate the guesswork, said a leading group of British scientists.
I think people are very shocked when they look at these amounts of calories and what it actually means for you physically.
We need to be more creative and more innovative in the way we think about tackling obesity.
The Royal Society, which advises the government on health, is proposing labeling food with simple symbols.
I think, I would think twice about buying crisps if I have to run 19 minutes just to burn the calories I ate from that.
I have to say that would 100% make me stop and think about buying crisps because I hate running.
I'd either consider working out those 19 minutes or not eating the crisps at all. So I think it's a good idea.
We believe that drugs should be treated in the same way that alcohol and tobacco are treated. That means that we try to reduce as much harm as possible on the people who are misusing the drugs, the people's families, their kids, and on society in general.
All the evidence we've seen internationally, if we look in particular at Portugal and other countries who have tried this approach of decriminalisation, actually removing that barrier to people accessing treatment increases people's chances of recovering from drug harm. And it also avoids the other harms which are associated with gaining a criminal record, like barriers to education and employment, which can harm your life chances going forward.
We showed our footage to Marie from the Royal Society for Public Health, and though she was disappointed by our findings, She wasn't surprised.
Looking at your clips, it's a very similar situation to the findings that we uncovered when we took our research. There's particular confusion around this issue of nuts and peanuts, and really in order to combat that, the only way that can be done is for staff to be properly trained in the details of allergens.
That's exactly the idea and the concept, and it is a novel concept working with such a diverse, wider workforce, but we already know that those conversations around particular health issues are already taking place.
People in the UK who have the opportunity to help and support.
A report out today says people like Jay should be harnessed and trained to help spread public health messages.
Jay is a good listener and is a guy that gives good advice. It's true, man. It's true.
I'm not just a barber slash therapist.
Slash agony aunt, slash consultant.
Oh gosh.
The vision is a public health workforce of millions of people like Jay.
Who wants that?
You found commuting potentially shortens lives. How? What is it doing to us?
Well, yes, you're absolutely right, and I don't think it's any surprise to Londoners. We actually have the highest commuting levels of anyone in the country, at just under an hour and 20 minutes. But it has its effect on our mental well-being, whether that's overcrowded trains or congested roads. It has its effects on our physical health, and that's often related to the length of the commute, and it can lead to increase in blood pressure or pulse rate.
Now they say this lack of sleep can actually seriously damage your health.
So the average slumber number for you would be somewhere between 7 and 9 hours.
Today, on the back of a health warning from the Royal Society of Public Health that we're all getting too little, we thought we'd take a look at the whole question of what historically has constituted a good night's sleep.